The future of health information technology. For one to look at the future of health information technology, one must look at its past. In an article written in 1959 by authors Ledley and Lusted, titled Reasoning Foundations of Medical Diagnoses, the authors introduced a new and exciting concept to the world. The authors state, the purpose of this article is to analyze the complicated reasoning processes inherent in medical diagnoses. The importance of this problem has received recent emphasis by the increasing interest in the use of electronic computers as an aid to medical diagnostic processes. Before computers can be used effectively for such purposes, however, we need to know more about how the physician makes a medical diagnosis. It's amazing to think that in 1959, the idea of healthcare informatics was so new that there were articles discussing its use, and further research prior to its inception. We have come a long way since 1959, with a projected 70,000 specialists needed in the nursing informatics field over the next few years due to the impacts of federal laws. A once not thought of career is creating a new path for nurses, physicians, and other healthcare professionals. Advancements and challenges. When we look at the future of healthcare in general, we look towards more personalized medicine. When looking specifically at the practice of nursing, there are a top few technological advancements that are on the forefront. These include, but are not limited to, genetics and genomics, less invasive and more accurate tools for diagnoses and treatment, 3D printing, robotics, biometrics, electronic health records, computerized physician order entry, clinical decision supports. As health IT grows, adoption of new health IT programs are geared not only towards better patient care, but better health and at a lower cost. This task is daunting and takes multiple disciplines on the same page for health IT to move in the right direction. One amazing example of health IT adoption and the programs that can occur from investment in them is the Beacon Community Program. This program, through the HHS Office of the National Coordinator for Health IT, provides over $250 million over a 3-year period to 17 selected communities that are making steady progress in the development of secure, private, and accurate systems of electronic health records and the adoption of health information exchange. Some areas of focus that the 17 communities are working on are building and strengthening the health IT infrastructure, translating investments in health IT to measurable improvements in cost, quality, and population health, and developing innovative approaches to performance measurement, technology, and care delivery. When we look at all these amazing advances, we must also take into consideration the challenges that come along with them. Some of the challenges that we could expect but are not limited to: increased data demands, data security, patient privacy, meaningful use, ICD-10, and social media. As clinicians growing practices in an ever-changing environment, these challenges can present daily issues for us. One area that is of the utmost importance and needs to be discussed first and foremost is patient privacy. With the advent of electronic health records, it seems that there is much more of a chance for patient information to be misplaced or placed into the wrong hands. We as healthcare providers need to ensure, as we build systems to accommodate our patient population, that the most stringent rules and processes are in place to make sure that patient information in portals are A, secure, and B, only accessible to the patient themselves. Now let's discuss data. Data is important for a myriad of reasons. Not only is data collected for billing purposes, but also data can help with day-to-day care, better estimate costs, and contribute to research. As patient privacy is a number one priority, data security falls under the same umbrella. Ensuring that patient information and patient data is not only collected correctly and disseminated appropriately, but also ensuring that data is safe and secure for future use is one of the top most important roles of a health IT professional. Lastly, and definitely not least, the use of IT can also present serious privacy issues and security issues. While Health IT offers you and your patients the opportunity for better quality and more efficient care, widespread use of Health IT also presents challenges to privacy and security. To address these challenges, the federal government's Health Information Technology for Economic and Clinical Health Act, or the HITECH Act, of American Recovery and Reinvestment Act of 2009, has strengthened some of the HIPAA requirements for privacy and security. In conclusion, it is almost impossible to place words on what the future of Health IT will be. All that we do know is that technology is always growing, and healthcare technology is growing with it. There are some that could not have even imagined that there would be a day when someone could access their medical information on a mobile device. But here in 2016, we are using our mobile devices daily. To be a part of an ever-growing, changing, and complex field is going to be one of the most enriching things for the nurse informaticists of the future. A career in health informatics is, in general, limitless. There are so many roles and opportunities to grow and create processes to better patient care. In the end, we are all working collaboratively towards one same goal: better, more efficient, more personalized patient care. If we all continue to work together, one day we will see how health informatics has played a role in changing the face of modern medicine.